Hi, everyone. Welcome. I hope that everybody is having a good day. I see participants getting on, and so glad that so many of you are interested in hearing about our new program that we're very excited about. So, as you are all getting settled, I'll just for those of you who don't know me, I'm Pam Brandon, the founder of AGE-u-cate Training Institute, and leading this great team who have been very, very busy and creative this last year. And I'm sure you join me in being very hopeful that we have a new year ahead of good things happening, and we certainly feel that way here. So, in any event, we we're going to take about 30 minutes of your time, your precious time, to go through the Reveal Aging program and talk about the why of us doing it, and moving right into having you take a peek at it, and then some Q&A. And of course, our team is always available to talk further to you about it. So with that, I am going to go ahead and, whoops, I got ahead of myself. I'm going to go ahead and get started. Again, I'm Pam Brandon, the president and founder of AGE-u-cate, and we are talking today about our new Reveal Aging initiative. So, in a nutshell, igniting change with practical, device-friendly workforce training with a focus on improving quality of life for older adults and their care partners. We pivoted, like many of you, last year as we saw all the challenges that we had due to COVID, and of course, core programs in place. For those of you who may be new to this session today, we are very, very committed to experiential training, very powerful programs now that are out and integrated all over the United States and in Canada and Australia. Our Dementia Live simulation program, Compassionate Touch, our skilled touch and engagement program, Flashback is our reminiscence training activity and staff training. We are working in collaboration and partnership with Reading to Connect, which is a cutting edge reading program that we are just so excited to be getting out to the aging services providers. And then, of course, we partner with Ageless Grace on our brain and body fitness program. So these programs have been in place, were in place last year, and then COVID came along. And what have we all been faced with but the tremendous challenges that we have in aging services providers in the area of workforce retention. And not only do we have to be worried and have our laser focus on how we get new workers into the aging services field, but then once we have them hired, what are we doing to retain them? Our CNA and direct work care workforce makes up 90% of those in healthcare. And I was just on a great seminar yesterday with Lori Porter from the National Association of Healthcare Assistants. Great speaker, really tells it like it is. And it's really, if it's not on the front and center of our associations and those who are advocating in Washington, it's the discussion that we're having around the conference tables, or rather in our Zoom calls now, of how are we going to attract workers to this field? They make up the backbone of our communities, of our organization, of this industry. But we've fallen short, no doubt about it. We have fallen short, and we have a lot of work to do. All of us stakeholders have a lot of work to do, and I'm sure all of you will agree with that. So no matter what area of the spectrum you are in, you are touched by the workforce challenges that we have now. So our team developed last year a white paper, which I'll give you information at the end of this on how you can access that white paper. And the presentation that I've done today is bits and pieces of that white paper to give you a flavor for, the why of the development of Reveal Aging, what it's all about, and where we're going with it. The programs are designed to maximize learner retention and practical application in the workplace. So Reveal stands for Responsive Curriculum for Today's Learning Needs, Experiential Learning, which you all know is the core of what we truly believe in here at AGE-u-cate in all of our program development. So experiential learning to drive changes in attitudes and actions. It has to be visually engaging and interactive. It has to be efficient content. No fluff. Let's get to the point of let's provide the tools and techniques that are important for care partners to put into action right away. So the efficient content has to be delivered in short micro-learning segments. And we're doing that approximately 10-minute segments each. Aging issues should be demystified and made relevant for the learner. And what does this ultimately do? It leads to more confident, skilled, and more satisfied care team. So Reveal Aging is a natural extension of what AGE-u-cate's core mission really is. We regard quality training as paramount for any aging services provider. We believe that for training to change knowledge, attitudes, and actions in care practices, a learner must engage on a cognitive and emotional level. And much of this is backed by research, and again, that is in our white paper. So what is the cost? What is the reality of what we're looking at today? So a staggering 64% of new hires in aging services turn over within the first 6 months of employment. I believe that we are going to see that number be drastically different during COVID. I think we're going to be astounded by what the challenges of COVID did to not only bring to light the challenges we already had, but the number of people that left for their own safety because they were ill themselves, because of the stress and challenges of the job, probably was higher than 64%. We certainly know in some of the nursing homes that number is higher. The cost of replacing an employee can be upwards of 16% of the annual salary for that position. Average salary of a CNA is approximately $30,000. We know that higher turnover rates in nursing homes for both licensed nurses and CNAs are associated with a higher number of deficiencies. And turnover affects quality of care and resident behavior. When we're continually putting new staff in that are not adequately trained. And again, it's that domino effect. We're short on staff. We have to get staff in, and we have to get them in quickly, get their basic sort of required training in, and then, get them on the floor. When we're not taking those steps to properly train them, we're putting our organization at risk, our residents at risk, and unfortunately, we're setting up that workforce for a higher likelihood of them leaving because they're not adequately prepared, especially for those who are caring for people with cognitive decline. And we know that number of people, whether you are in hospital, in long-term care, at any level, that we're seeing higher and higher numbers of people who have dementia at some level. Turnover impairs the knowledge of patients' needs required and it zaps our person-centered care initiatives. Absolutely. When we, as an organization, say we are going to be committed to person-centered care, to teaching care partners behavior management, but we don't give them the proper tools, then that person-centered care mission that we have, an initiative, and integration throughout our staff evaporates. We just know that, and we know we've taken some steps back with COVID, and we've got to get back in the game. We have to get back on track. So let's pivot a little bit to talk about the modern worker. The modern worker is motivated to learn. They want to be given relevant, timely content in a convenient mobile format so that they can learn anywhere and anytime. And in developing this, I'm certainly far from a millennial, as many of you are, and most of our team. Haven't we all learned differently? I mean, what we have in front of us, what we work in front of every day is our computer. And then what do we do when we're not on our computer? We are on our mobile devices. We're on our tablets. We don't spend a lot of time. It's either relevant information that I can grab now and very quickly, or we move on. That's just the way our brains have adapted since technology has become increasingly a part of our lives. So we know we need to change, whether we are teaching a millennial or someone many generations beyond that. We need to adapt because the way we are learning is changing rapidly. By 2025, which used to sound like a long time off, is right around the corner. Millennials will make up 75% of the workforce. And they say that learning development, 87% of those millennials say that on-the-job learning and development is important. On the job. Let me learn while I'm working. That is a challenge for direct workers, for CNAs, for nurse assistants. That's challenging. Because of the shortages, we have to give them their required training, and then we have to get them started working. How can we intersperse practical, effective training while they're on the job? Low satisfaction with orientation and training is a contributing factor in seeking other employment. And sometimes those decisions can be made by an employee in very short order. So we have to give them the tools they need fairly quickly for that employee, especially a millennial, to decide if they are going to stay with the organization that they have been employed by. Our aging services workforce needs to feel valued. One of their greatest needs is to feel valued. Yes, we have to pay them more. Yes, we have to do a better job at training. Yes, we have to value them, and they have to feel like they are embraced by their organization and that they are an important part of contributing to meeting that overall mission. And they are the backbone of the organization. They are the ones who are on a daily basis on the front line of caring for the residents, the families. They're caring for each other. So let's not do, as Lori Porter said yesterday, we've been doing too much trickle-down training. We have to prioritize their training because they are the ones who are truly leading our mission in the organization. So I want to move on and let you take a peek. We've chosen two of our first modules of the Reveal Aging initiative. I'm going to talk about all the other courses that we have and will be rolling out over the course of of this year and beyond. Our first course was our Compassionate Touch training. Compassionate Touch, for those of you who don't know, is a very effective, powerful, flexible, skilled touch training and engagement training that has proven results in 20% and more, almost 30% in some cases, of reduction of behaviors, reduction of antipsychotic medications, reducing stress, reducing cortisol levels. So we took our first course that we chose was to put this Compassionate Touch training, which in the past has been a coach training, where coaches could then teach their staff, was to give the Compassionate Touch trainers direct to the care staff with a 1-hour training in micro-learning content. What you are seeing here is the desktop version of this. All of our programs will be offered on a desktop version, tablet, or mobile device. So desktop, laptop, mobile, and mobile device. So this one is created for the desktop version. So let's take a peek at this.
Compassionate touch involves little risk when used as instructed in this video. However, you must be informed about precautions so that your touch is safe as well as beneficial. First, a few guidelines that apply to all the techniques you'll learn in this series. Safety is always a priority, and for some people, gloves, a gown, or mask may be necessary to meet infection control requirements. And of course, wash your hands regularly. We'll provide additional safety tips relevant to each technique. Offer compassionate touch to the person wherever they are at the time, whether in a wheelchair, bed, chair, or recliner. We'll cover positioning tips for each technique. Techniques can be applied through clothing or directly on the skin. Some elders may have times when they aren't open to skilled touch. How can you tell if the person is receptive or not? By paying attention to the nonverbal signs.
Now we're going to do the hand technique. And the first thing that you want to do is make sure you connect with the person. Hi Margie, how are you?
Very good, thank you.
Good. Is it okay if I maybe rub your hands? Do you think that would feel good?
That'd be very nice, thank you.
So after you get permission, you want to set up her hand in a nice comfortable position. So if you have a bed pillow, something like this, you can put it underneath her arm. And you want to position yourself parallel to the chair. Are you comfortable?
Very, thank you.
Good. So making sure your person that you're working with as well as yourself are in a comfortable position. The next thing that we're going to do is start to warm the hand. So I'm going to warm up your hand, Miss Margie. So as you're putting the lotion on her arm, you want to make sure that you have your palm to her skin. We're going to turn your hand to the side, and we'll start palm to palm in a circular motion. We'll do this about 6 to 8 times. With compassionate touch, though, we're very flexible, so if you only have time to do 4 to 6 strokes, it's still going to be very effective. All right, Margie, I'm going to turn your hand up. There we go. So after you complete the techniques on this side, you can repeat the sequence on the other. And then for the closing, you want to make sure that you just thank your care partner for their participation. So thank you, Margie, for letting me rub your hands.
Very nice.
Yes, thank you.
Okay, so you can see that,
Compassionate touch.
sorry. So you can see that by having the techniques right there, a caregiver can have it on their phone or maybe tablet, and they can be working with their resident, maybe working with another care partner and practicing the techniques, and the video is right there with them. So very, very powerful on the job. They get to practice right there, and again, in 10-minute segments. So very easy to implement. Let's look at, and this is the mobile version of the Dementia Care Basics, which is our second one that we created.
Before we take a closer look at Alzheimer's symptoms, it's crucial to understand how they progress. To begin with, you'll recall Alzheimer's damages brain cells and the disease affects different parts of the brain in a pattern, producing predictable symptoms over time. Experts have identified stages that describe how a person's abilities change from normal function through advanced Alzheimer's. Here are some communication tips. Avoid questions that require short-term memory, but keep the conversation here and now. Instead of asking, "How is your morning?" say, "It's a nice sunny day today." Avoid using the phrase, "Don't you remember?" Tap into memories from long ago. Help them reminisce about the past. Knowing something about their past interests will help you get clues from the things such as pictures, music, etc. An example, "I hear you love to grow a garden. Do you like flowers?" The second is confusion of time, place, and people. They may lose track of the time, day, or the season. Often, people have trouble finding their way around and may become lost, even in familiar places. They may walk about, possibly in search of surroundings that make them feel more comfortable. It's important to understand that a person's memory lapses and confusion may not occur 100% of the time. It will likely fluctuate. They will have moments or periods of clarity and self-awareness, sometimes to a surprising degree. Here are some tips. Be aware that they understand more than the words they express. It is easier to answer yes or no questions. For example, "What do you want for lunch?" Ask, "Do you want soup?" Be patient. Allow the person time to absorb what you said. Let's talk about loss of interest or motivation. People often show less interest in doing things they used to enjoy and may withdraw socially. They may appear to lack motivation to start an activity, even grooming or eating. They may have trouble staying with a task or lose interest quickly. Here are some tips. Watch for signs of pain. Anticipate needs such as shifting positions or changing a brief. Play familiar music from the person's past. If possible, take them outside for fresh air or use touch for a human connection. Although Alzheimer's symptoms are experienced differently from person to person, understanding the changes will help you to carry out your work with greater confidence and compassion.
Okay, so you can see that the development of how we put these together. We have photos. We keep the learner engaged by the speaker being on, and then at times having a voiceover with the bulleted items. Those are all techniques of engaging micro-learning delivery. At the end of each module, which again is about 10 minutes, there is a test. So just very quickly to show you the test questions and how the sequence of that. So they would submit an answer for the 3 questions and then move on. So I'm going to move on from there. They are given a certificate at the end of the course when they have successfully completed 80% or more. They obviously can go back and retake the tests. They can fast forward through a course. They have to take it in order, but then they can print out the certificate at the end. So overview, again, device friendly, desktop, tablet, mobile, laptop. They are all approximate 1-hour courses delivered in micro-learning content modules of approximately 10 minutes each. So all of our courses will have between 5 and 6 modules. 3 questions at the conclusion of each module. The learner receives a certificate upon successfully completing the course and a passing rate of at least 80%. The learner will have access to each course for 60 days, giving them time to practice, to again, if we feel like, and we know if they have 60 days to practice this, that's enough time to have it ingrained and for them to really integrate what we're teaching into their care practices. The certification is good for 2 years. So their certificate is good for 2 years. One person from your organization can be assigned as an administrator with progress monitoring privileges. Some of the courses, thank you to our providers out there, to many discussions we've had with our association partners who have given us the topics that they would like to see. So this is just a sampling of some of these. We are prioritizing as we get specific requests in. So we want to hear from you if there are other topics that you would like to see, but you will see these being rolled out pretty aggressively this year and into next year. So where do we go from here? And we're going to have some times for Q&A, but just very quickly, you can go to our Reveal Aging program page on our website now, get more information. You can access our Reveal Aging white paper, which again has the references and the research behind the development of these programs. Pricing for a single course is $25 with quantity discounts. Those discounts are listed on the program page. And then enterprise subscription-based offerings are available. Those would be for providers who want to go to a monthly subscription-based service. Association partnerships are welcome. We are working with one association now where we're going to be offering their members a discount. In other scenarios, associations may want to have a small revenue share with us for programs that are offered through their website to their members. We're happy to give you a course to audit, so that's no problem. We want to hear if you have specific course topics. We've had lots and lots of discussions with our partners, and that's how we've developed the course topics that we've listed in the previous slide. And we can do customized branding. That's going to take a little bit longer, and there's another charge for that. But if that is something that you'd want to do, we can certainly talk to you about it. So let's open it up for questions from anyone on something that I didn't touch on and that you may have a question on. I will tell you that the next course that is being developed and will be ready next month is Empathy and Communications. And for all of you who have the Dementia Live program, really great add-on for that program that brings just the relevant, again, the relevant topics, the relevant tools that a care partner will need to develop their empathy and communication skills. So any questions or comments? We're right at 1:29, but we will stay on if there are questions, because if you have one, others may have one too. Please share your background in the field of aging. So my background, I had on-the-job training for over 15 years. My dad was diagnosed with Alzheimer's when I was 35 years old. I went on that journey together with my parents until he passed 5 years later. And then shortly thereafter, my mother was diagnosed with Parkinson's, and we went on that journey together for almost 10 years. So during that time, I became acutely aware of the needs of family caregivers, of the lack of training on the aging services provider side, from hospitals through the aging spectrum. Had the unique opportunity after that to work in partnership with the area agencies on aging in developing in North Texas, developing and delivering family caregiver education. Did that for many years, and it was during that time that I really transitioned to focus the AGE-u-cate's efforts, which was founded in 2011, in professional training. I will say, though, that all of our programs, this is very unique to AGE-u-cate programs, all of our programs include a family education component, and that is true of every course of the Reveal Aging programs. We always talk about how the learner can also understand where families are coming from and also help families and communicate with families, whatever that topic is. So thank you for that great question, Pat. It is very difficult to get staff onboarded and help them. Yes on all your comments, which you're spot on. Yes, thank you, Julie. All of this is not just care partners, nursing, dietary, housekeeping, life enrichment, maintenance. Let's be clear that if we're going to create change in an organization, we have to train everyone. We certainly know that with our Dementia Live program. Many of our providers, and these are multi-site, many communities on board, home care providers, they train everyone in the organization from executive to maintenance and everywhere in between. So really important that we keep everyone in that learning loop, and know that person-centered care must include the family. And that is why it is a big part of all of our programs. So cutting edge modalities and problem solving. Well, Susan Ostrowski, you know about cutting edge because you are the creator of Reading to Connect, which is another great cutting edge program. We want to partner with you, and we want to hear from you. Our feedback and our program development comes from what we hear from our partners and those conversations that we have. So you can reach out to me or any of our staff, and we want to hear from you. So at that, I'm over our 30 minutes. I want to thank all of you for taking the time to take a peek at this and hopefully get on board with us with these programs to help you and those who you have in your organizations to elevate their level of being able to provide quality care. So thank you. Have a great rest of your week, and join us on April 16th, I believe it is, 21st, for Robert Espinoza from PHI, who's going to be talking about workforce policy, right in line with what we're talking about here. He's an amazing speaker. So you have an opportunity to sign up for that, and hope to see you then in April. Thank you all. Have a great day. Bye-bye.